Hey everyone, Dr. Mike here. Today, we're diving into a serious topic. Diabetes in toddlers. It's a condition where the body either doesn't produce enough insulin or can't use it effectively. Insulin is like a key that lets sugar, glucose, from our food enter our cells for energy. When a toddler has diabetes, that sugar builds up in their bloodstream, leading to various health problems. Recognizing the early signs of diabetes in toddlers is crucial. Unlike adults, toddlers can't always communicate what they're feeling. That's why we, as parents, caregivers, and healthcare providers, need to be extra vigilant. We're going to go through 10 subtle signs of diabetes in toddlers that often get overlooked. So let's get started. One of the earliest signs of diabetes in toddlers is increased thirst, also known as polydipsia. You might notice your little one constantly asking for water or juice, even if they've just had something to drink. This excessive thirst is often accompanied by frequent urination, known as polyuria. If you're changing more wet diapers than usual, or if your potty-trained toddler is suddenly having more accidents, it's essential to pay attention. Another red flag to watch out for is unexplained weight loss. When the body can't utilize glucose for energy due to insufficient insulin, it starts breaking down fat and muscle for fuel instead. This can lead to sudden and unexplained weight loss in toddlers, even if their appetite seems normal or even increased. If you notice your toddler's clothes are fitting looser, or if their growth seems to have plateaued, consult your pediatrician. You know how kids are always hungry, right? Well, with diabetic toddlers, this hunger can be insatiable. This increased hunger, known as polyphagia, is another classic symptom of diabetes. Because the body isn't able to use glucose for energy efficiently, the toddler is essentially starving, even if they're eating more than usual. While a healthy appetite is normal, extreme hunger that doesn't subside even after eating should raise concern. Imagine feeling tired and irritable all the time. That's what toddlers with undiagnosed diabetes experience. Because their bodies can't utilize glucose effectively, they lack the energy they need to function optimally. This can lead to constant fatigue, making them lethargic and unwilling to participate in their usual activities. If your usually energetic toddler is suddenly always tired and cranky, it's worth considering diabetes as a possibility. This one might sound strange, but trust me, it's important. When the body can't use glucose for energy, it starts breaking down fat for fuel. This process produces ketones, which can build up in the bloodstream and cause a sweet, fruity odor on the breath. While this symptom is more common in diabetic ketoacidosis, a serious complication of diabetes, it can also occur in undiagnosed or poorly managed diabetes. If you notice a persistent sweet smell on your toddler's breath, don't ignore it. High blood sugar levels can affect the tiny blood vessels in the eyes, leading to blurred vision. Toddlers might not be able to articulate that their vision is blurry, but you might notice them rubbing their eyes frequently, squinting, or having trouble focusing. If you observe any of these signs, it's crucial to schedule an eye exam with a pediatric ophthalmologist. High blood sugar levels can weaken the immune system, making toddlers with diabetes more susceptible to infections. They might experience frequent colds, ear infections, skin infections, or urinary tract infections. Additionally, high blood sugar can also impair wound healing. If your toddler's cuts, scrapes, or insect bites seem to take longer than usual to heal, or if they develop frequent infections, bring it to your doctor's attention. Diabetes can manifest in unexpected ways, including behavioral changes. Fluctuating blood sugar levels can affect a toddler's mood, energy levels, and overall demeanor. They might exhibit increased irritability, anxiety, difficulty concentrating, or even bedwetting. If you notice significant and persistent changes in your toddler's behavior, consult your pediatrician to rule out any underlying medical conditions. Diaper rash is common in toddlers, but a persistent diaper rash that doesn't respond to the usual treatments could be a sign of diabetes. High blood sugar levels can create a favorable environment for yeast growth, leading to fungal diaper rash. This type of rash is often bright red, may have small red bumps surrounding the main rash, and can be quite uncomfortable for the toddler. If you notice a persistent diaper rash that doesn't improve with over-the-counter remedies, consult your pediatrician. While vomiting and abdominal pain can be symptoms of various conditions, they can also be signs of diabetic ketoacidosis, DKA, a serious complication of diabetes. DKA occurs when the body doesn't have enough insulin to use glucose for energy, so it starts breaking down fat for fuel instead. This process produces ketones, which can build up in the bloodstream, leading to nausea, vomiting, and abdominal pain. DKA is a medical emergency and requires immediate medical attention. Recognizing these signs and symptoms early is crucial for the well-being of toddlers with diabetes. Early diagnosis and treatment are key to managing this condition effectively and ensuring a healthy future for our little ones. If you notice any of the symptoms we've discussed in your toddler, consult your healthcare provider immediately. Early detection can make a world of difference in the life of a child with diabetes. Let's work together to raise awareness about this condition and ensure that all toddlers receive the care they need to thrive.